40,000 tonnes consumed annually, one of the world's most widely used medications and been around for over 100 years. Also known as ASA, what is it? Aspirin. It's a non-steroidal anti-inflammatory drug. Aspirin, what's it used for? It's used to treat pain, both chronic and acute. It reduces fever and inflammation and is used to treat rheumatoid arthritis. To inhibit platelet aggregations and therefore reducing the risk of transient ischemic attacks and unstable angina, and the prevention method for strokes, heart attacks and myocardial infarction. So what are the benefits? Low-dose aspirin therapy has shown to prevent 1 in 5 atherothrombotic vascular complications. These include non-fatal myocardial infarction, non-fatal stroke, and vascular death. Another study found that aspirin therapy reduced the incidence of cardiovascular events by approximately 10%. As well as these benefits, there are also a number of risks associated with aspirin cardioprotective therapy. These are intracranial bleeding or hemorrhagic stroke, extracranial bleeding, mostly in the gastrointestinal tract. Aspirin works by inhibiting both cyclooxygenase 1 and cyclooxygenase 2, better known as COX-1 and COX-2. COX-1 has a number of responsibilities: normal cellular function, gastric mucosal protection, maintenance of renal blood flow, and platelet activation and aggregation. COX-1 is expressed in the endoplasmic reticulum. COX-2 is responsible for the production of prostaglandins that contribute to inflammatory response. However, COX-2 is not routinely expressed in mammalian cells. It's rapidly induced by inflammatory stimuli. In the presence of COX-1 and 2, arachidonic acid is responsible for the formation of prostaglandins, the precursor of thromboxane A2. Aspirin irreversibly inhibits the production of COX-1 and 2, which in turn prevents the production of prostaglandin hormone, and therefore resulting in the therapeutic effects and toxicities. Without aspirin, COX activates thromboxane A2 and causes platelets to stick together and aggregate. However, in the presence of aspirin, COX is inhibited and therefore reducing the ability of the platelets to aggregate. There are a number of factors that need to be considered before the use of aspirin cardioprotective therapy. This therapy is recommended for patients who have suffered from a heart attack or stroke in the past, patients with a coronary stent, coronary bypass, or are suffering from angina. However, people suffering from diabetes, individuals using other non-steroidal anti-inflammatory drugs, hemophiliacs, and people who display allergies to aspirin, and those who suffer from gastric ulcers are all at greater risk of suffering from the adverse effects of aspirin therapy.